uh, and others can join us along the way. So I just want to take a moment and say welcome to everyone to this CWRH seminar series. I am delighted to introduce Dr. Rohan Hazra, who is our speaker today. Dr. Hazra is the acting Associate Director for Extramural Research at the Eunice Kennedy Shriver National Institute of Child Health and Human Development, NICHD, a National Institute of Health Center. Up until this year, he was the chief of the maternal and pediatric infectious disease branch. And I know many of our ID colleagues are very familiar with Dr. Rosen and Hazra and work with him. So until March this year, he was the chief of that branch. In this new position, he oversees 12 NICHD extramural scientific branches. And so just, a lot of work there. He joined NICHD in 2007, and through this work has led pediatric HIV and other infectious disease clinical trials and observational studies here in the US and globally, where there is just a huge HIV portfolio. So with respect to his background, Dr. Hazra received his BS degree in biology from Yale University and his MD from Johns Hopkins. He completed a pediatric residency and a pediatric infectious disease fellowship at Children's Hospital in Boston. Prior to joining NICHD, he conducted clinical trials in pediatric HIV at the National Cancer Institute's intramural program. He is certified by the American Board of Pediatrics in both pediatrics and pediatric infectious diseases. So please join me in welcoming Dr. Hazra. Again, thank you for joining us, and over to you.
Oh, thank you, Alan, very much for the invitation. I think you started talking to me about potentially actually coming down to Birmingham quite a while ago. Yeah. So sorry I can't be there in person, but really appreciate the opportunity to speak with all of you today. So I guess, Candace, if you could pull up my slides, and I will get started. I will say that I think, Alan had suggested, I think wanting to hear a little bit about sort of our overall about the Institute and its agenda in women's reproductive health. But I also think one of my goals in this is to really, at some level, especially for residents and other trainees, is to try to demystify the NIH a little bit as well. In fact, Dr. Tita sits on our advisory council, so he was just virtually with us for the last 2 days. But one of the retiring members, Catherine Gordon, who's head of adolescent medicine in Boston, she actually commented that one of the things that she's really learned from being on council is that there are actually humans behind all of the decisions that come out of NIH. And I think to really, really try to reinforce that message that, people are, on the extramural side, we are here to really try to be of service and a resource to all of you as you navigate through the various different funding mechanisms and opportunities at NIH. So with that, I'll get started. So next slide, please. So just a brief outline. So I'm going to tell you about our recently revised mission and vision and talk a little bit about our strategic plan. And I think hopefully convince you that women's reproductive health is a major part of what NICHD proposes to support and accomplish in the coming years. I want to share with you some about our organization. And again, this is partly again to try to demystify some of what happens at NIH. Of course, at this day and age, you can't give a talk without mentioning something about COVID-19. So I wanted to touch on a little bit, at least, of what we're doing so far with respect to the pandemic and women's and reproductive health. And then I was going to touch on two topics that have gotten a fair amount of both publicity, but as well attention at NIH, is the maternal mortality, talk about maternal mortality, and then this task force on research specific to pregnant women and lactating women. And then I had a bunch of other things. Again, if we had more time, that would be able to have more about these things. But I just wanted to make sure that you knew about a few things. And so I just, for lack of a better term, I'm calling that miscellaneous items. And that's about half a dozen slides, just touching on some other resources and informational items that I hope will be benefit to you. So next slide. Next slide. So our mission statement is here. And so the NICHD leads research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. And so next slide, sort of summed up more with our vision statement, which is healthy pregnancies, healthy children, healthy and optimal lives for all. And I just want to spend a few minutes on this slide just to explain to you what we do cover. And so I'm going to start with that middle one there about healthy children. Obviously, child health is in our name, and so it's quite clear that we support pediatric research and child health research. But I think what's probably not very well known is that while we are the largest supporter of pediatric research at the NIH, we actually fund only about 18 or 20% of pediatric research at NIH. So it basically means that all of the other institutes and centers, of which in total there are 27, the other 26 collectively support about 80% of pediatric research. By contrast, going to the first part of this vision, healthy pregnancies, we actually support the majority of pregnancy-related research at NIH. And so approximately 55% of pregnancy-related research is at NICHD, even though pregnancy and reproductive health are not in our name. And so I think it's an important issue to recognize. And then that healthy and optimal lives, of course, refers to everyone that's ever been pregnant, anyone who's ever been generated by a pregnancy, but it also especially includes individuals with intellectual and physical disabilities. And about actually 30 years ago, NIH, there was a law that established a National Center for Medical Rehabilitation Research, and that sits at NICHD. And so that is both a granting center, so it supports grants, but it also helps to coordinate all rehabilitation research, not just across NIH, but also with other US government agencies such as the Department of Defense and Veterans Affairs. So healthy pregnancies, healthy children, healthy and optimal lives, because we have a very strong and large pregnancy and reproductive health related agenda. We, of course, do pediatric research, and then we have the National Center for Medical Rehabilitation Research as well. Next slide, please. So as part of actually the 20th Century Cures Act, which was one of the final pieces of legislation that President Obama signed. He signed it in December of 2016. As part of that act, each institute at NIH is required to establish a strategic plan. Many of the institutes actually had already been doing this on a regular basis, but actually at NICHD, we had not done one since 2000. So this was actually quite a new activity for the Institute. And Diana Bianchi, our director, was relatively new actually when this requirement came in. So she immediately launched actually a 2-year process where we systematically collected information from the extramural community, from other stakeholders, including advocacy groups, and then also internal to NICHD and NIH, and had a series of meetings, listening sessions, workshops, and the like to hone the strategic plan. And it was released about 1 year ago today. That's the cover of it, and probably easy. I'm sorry I didn't include the link here, but it's probably pretty easy to find if you Google NICHD strategic plan. There are really 3 focus areas: scientific research themes, which is what I'll spend a slide or two talking about, but there's also an area around scientific stewardship and management and accountability. Next slide, please. So as part of all of the efforts that I mentioned, a 2-year process that Dr. Bianchi led, at one point, there were actually well over 200 different scientific themes that were identified as being potentially worth prioritizing within this strategic plan. And so over a course of, again, many, many months with lots of different conversations and discussions, these were honed down to these particular 5. So number 1 is understanding the molecular, cellular, and structural basis of development. Theme 2 is promoting gynecologic, andrologic, and reproductive health. Theme 3 is setting the foundation for healthy pregnancies and lifelong wellness. And I think this, I'm sure to this audience, is not a big surprise, but as we all know, when we're dealing in pregnancy and reproductive health, that there's a lot that happens in pregnancy that really is a mirror into what will actually happen for that woman's health in the coming decades. In addition, there's so much of fetal programming that then impacts on the health of the child and frankly the adult, the whole issue about developmental origins of health and disease. So the wording of this was chosen very carefully, I think, to really try to include that whole concept of pregnancy as kind of a stress test almost for a woman's health, and then this whole issue around developmental origins of health and disease. Theme 4 is improving child and adolescent health and the transition to adulthood. And theme 5 is advancing safe and effective therapeutics and devices for pregnant and lactating women, children, and people with disabilities. Next slide, please. We realized as we were having all of these discussions, there are, of course, a number of themes, a number of very important aspects of research into these kinds of areas that could potentially have been their own individual theme, or to really realize that actually they cross-cut through everything. And so these are what we are calling the cross-cutting themes, where the hope is that over time we will be addressing these 5 areas in all 5 of the areas as well. And so global health, Dr. Tito will be happy to see, is prominently displayed there. Health disparities, prevention, nutrition, and infectious disease. Next slide. In addition to this strategic plan, which is really to help inform what we do over the next 5 years from 2020 to 2024, the 20th Century Cures Act also called for what I think in the legislation it may have said aspirational goals, but if not, that's what they really were. Sorry, just go back. So the aspirational goals were really these goals of if we are able to accomplish the science that we really want to, then down the road, what potentially is possible. And so we identified, again, in this very collective iterative process, these 10 aspirational goals, with the idea that these are not necessarily things that we will accomplish during this timing of the strategic plan, but really hoping that we at least start establishing some of the fundamental knowledge and biology that we need to be able to address them. And I will just highlight a few of them. Goal 3 there is to diagnose, treat, and cure endometriosis. Goal 4, predict pregnancies at risk for fetal loss. Goal 5, talking about the fetal-maternal immune relationship. Goal 6, about premature infants. And Goal 8, around synthesizing and personalizing human milk. And so certainly a number of aspirational goals that really, I think, speak to the women's reproductive health agenda. Next slide, please. So what we're now doing is implementing this plan. And Dr. Tita, as I mentioned, sits on our council. We're really so grateful and actually very fortunate to have him there. And as he knows, one of the major aspects of this is transparency. And so our director, Dr. Bianchi, will be periodically reporting to our council on our progress on the strategic plan. But for right now, what have we done? Well, what you'll find if you go onto the NICHD website and look up, and I'll show you the different branches in a couple of slides, each of the branches revise their priorities. So this is the areas that they are saying are priorities for them. These were all revised and then finalized in light of the strategic plan. So that's something I think good for folks to know about, that when you're thinking about applying to NIH, is really to try to figure out where your research fits. And so these priorities hopefully can help with guiding where to go. There's also a plan to do a phased approach that enables flexibility and incorporates resource limitations. And, you know, boy, the last 6 months and the COVID pandemic it really showed how important this whole issue is, where 6 months ago, of course, or 8 months ago, had no plans for doing a COVID-19 research agenda. And yet now, obviously, that dominates many of our conversations and our days. So Candace, if you'll just click through probably 5 or 6 times, because it's just I think a bunch of things here. Yeah. And then 1, 2, 3, 4, 5. Great. Okay. So we do, you know, so we want to set this plan, but we do also recognize that things are going to emerge like COVID-19. And so to retain some amount of flexibility, I think, of course, again, too, the pandemic has really brought home how quickly we need to incorporate technological advances, especially around communication. I mean, look at this, you know, instead of flying down to Birmingham and having a nice dinner with some of you, you know, we're able to do all of this through Zoom. And then, of course, the other thing we're doing is, of course, while implementing, is actually implementing and actually doing and supporting some of the science that we talk about. And so these are just some examples, but for that developmental biology theme, we've reissued an FOA for NICHD's Intellectual and Developmental Disabilities Research Centers, and we're about to fund the next round of those. For the gynecologic and andrologic health, we've established an intramural, so that's within the NIH, adolescent and pediatric gynecology program. For the pregnancy and lifelong wellness, and I'll talk about this in a little while, about maternal mortality and the research agenda in a workshop that we held recently. Theme 4 about pediatric and adolescent and transition healthcare. We have a workshop actually later this month on navigating the pediatric to adult healthcare transition. And then theme 5 about drugs and devices in pregnant and lactating women and children. I'll also talk about this is the PregLac task force. So there have already been activities that address the 5 scientific themes. Next slide. All right, next slide. So again, here I'm trying to demystify a little bit what happens at NIH. So this is just our organization, NICHD. So you have Office of the Director, as I mentioned, Dr. Diana Bianchi, who is a neonatologist and geneticist, is our director. On the left there, you see that she has a number of offices that report into her. That includes an Office of Health Equity and an Office of Global Health. And then to the right are the 3 divisions and centers. And then in the middle, those blue boxes are these advisory councils. So our Rehab Medicine Center has an advisory board. That middle one is the one that Dr. Tita sits on. And then there's a board of scientific counselors that advises on the intramural program. And there to the right, the 4 boxes, you kind of see I've highlighted in red there the Division of Extramural Research. That's where I come from. On this organizational chart, it just looks like one of a medium-sized box on a pretty busy slide. But in fact, of the 1.5 or 1.6 billion dollars that NICHD has in its budget every year, more than 2/3 of it are in the Division of Extramural Research. So we oversee about 1.1 billion dollars in research funding there. And so if I were to do this slide from my vantage point, maybe that box would be in the middle and all the others would be around it, but I'm just kidding. Of course our director needs to be in the middle. As I mentioned, we have a National Center for Medical Rehabilitation Research that was established 30 years ago. I just want to point out there that one area of research that's been important there is pregnancy and pregnancy complications in individuals with physical and intellectual disabilities. So that's certainly, even within a rehab medicine center, there's pregnancy-related research. We have a division of intramural research that is both basic science and clinical, but importantly, there's actually a perinatology program within that intramural program, but that is based at Wayne State University in Detroit. So we have pregnancy-related research in our division of intramural research, and then we also have this division of intramural population health research, and as I'll just show you in a second, that group also has a large number of pregnancy and reproductive related projects. And I think the important thing there is once those projects are completed, oftentimes the data and specimens are available to the general biomedical community for secondary analyses. So also a group to as a potential, that has potential resources to draw upon. Next slide. And Alan, I am not monitoring the chat box, but I do see sometimes that there chat coming up. So certainly if there are questions, this is really for the audience here. And so please feel free to break in and ask a question, but I hope that I'll certainly have time at the end to answer questions as well.
Yeah, that sounds great.
Okay. So as I mentioned, the Division of Extramural Research, that's 12 different scientific branches. So I've listed all 12 here. And what I've highlighted in red is, again, the ones that relate to women's and reproductive health. So we have a contraception research branch, a developmental biology and structural variation branch that deals with birth defects and developmental biology, a fertility and infertility branch, the gynecologic health and disease branch, and that branch oversees the pelvic floors disorders network, for example, which I'm pretty sure UAB is a site for that network. We have my old branch, the maternal and pediatric infectious disease branch. We have an obstetric and pediatric pharmacology and therapeutics branch. We have something that's called pediatric growth and nutrition branch, but that branch will likely get renamed because within that branch, there's a fair amount of pregnancy-related research around gestational diabetes and developmental origins of health and disease. We have a population dynamics branch that deals with a lot of reproductive health within the population health field. And then we have probably the pregnancy and perinatology branch, which houses the maternal fetal medicine units network, for example. So again, something that Dr. Tita and you all at UAB are very familiar with. So again, just want to emphasize that a lot of women's reproductive health at NICHD, but then even within NICHD, there are lots of different branches that cover aspects of that agenda. And so again, to stress that what people should do as they're thinking about ideas, go on the website, look at the priorities, reach out to staff, reach out to multiple staff, depending upon your project, and get input on how staff think it fits within the priorities that are there on the websites. Next slide. So I just listed here just some historical accomplishments within the field of women's and reproductive health. So, we right from the beginning, in fact, my original branch was established because of the maternal and pediatric HIV epidemic. So of course, do take some credit as an institute for mother to child transmission of HIV. HIV has been nearly eliminated. Certainly in some countries, the official elimination targets have actually been met. NICHD funded scientists were the first to diagnose abnormalities in children whose mothers drank alcohol. So the whole fetal alcohol syndrome identification was first done by NICHD funded scientists. NICHD investigators identified beta HCG. NICHD research found the issue around folic acid and neural tube defects, and then importantly, prenatal surgery, the MOM study to repair myelomeningocele prenatally is just one example. So just some examples, I think, to show you just sort of the range of the types of research that are supported by NICHD, but also I think to highlight some really major accomplishments over the last 30 years or so. Next slide. And then this is, I'm not going to walk through this in detail, but I think just to give you a sense of some of the programs and projects that relate to pregnancy and women and children and perinatology. And again, from across the whole range of the institute. So there are individual names of projects there that also sometimes will have on the web or through investigators certain resources that may be helpful too. Next slide. All right, COVID-19, next slide. So of course, COVID-19 has dominated, I know, between the impact of the pandemic and then a research response has really dominated many of our lives over the last 6 months. This is a slide that kind of summarizes a lot of activity that's gone on at the NIH over the last 6 months. And so this is trying to, I think, summarize trans NIH efforts, so it doesn't go into individual institute efforts. But what you'll see there are in the main circle, these 7 spokes or 7 outer circles are the 7 main trans NIH COVID-19 efforts. And I want to highlight to you, of course, that over there right around 3 o'clock is one individual one on pregnant and lactating women and children. So we at NICHD with colleagues at NIDA co-lead that effort. But then also want to talk about a couple of others, because one of the things that we have stressed in that working group and in our interactions with the others is that we can't put all of research in COVID-19 and pregnant and lactating women just in one silo. It impacts all the others. And so, for example, starting at about 11 o'clock, there's a whole massive program, what's called RADx, which is Rapid Acceleration of Diagnostics. And so really have been stressing there the importance of inclusion of pregnant women and of course about infant testing in those programs. If you move clockwise, there's this active public-private partnership, which is accelerating cures and treatments for accelerating COVID-19 treatments and vaccines. So lots of different trials that are being undertaken there. Again, really trying to make sure that pregnant women are considered for inclusion. And in fact, again, yesterday at our council meeting, or 2 days ago at our council meeting, we had a division chief from NIAID talking about some of the efforts around trying to study the vaccine candidates in pregnant women. And then down to the left there around 7 o'clock is social and behavioral. That's actually a major program that just had a supplement, a relatively large supplement competition, where again, we really advocated for the importance of including pregnant and lactating women. So we have our own group that has probably most of the NIH institutes and centers represented on it, but we're also utilizing our advocacy to make sure that these other groups don't just assume, oh, pregnant women are already taken care of in this one little box or one little circle. No, we have to really make sure that our populations are included in these other efforts. Next slide. And so this is this active project, just in case folks want to know more about it. There was this paper that Dr. Collins and his co-chair of Active from Johnson & Johnson wrote. Really lays out the whole vision for this. And again, this is the group where we're really trying to push that there needs to be a real systematic plan for how to think about vaccinating women of reproductive potential and pregnant women. Next slide. And then within NICHD, so as I mentioned, that slide that with all the circles on it are trans NIH efforts, but then within NICHD, we're also doing a number of different activities. So again, Dr. Tita knows well that through the MFMU, we're launching a study comparing essentially the impact of COVID-19 on pregnancy and infant outcomes, really comparing what happened last year to a similar time frame this year. But importantly also, I think developing data collection elements and methods that we then are able to share with the other networks and other projects that are actually considering this. So as again, the hope is that we will be able to align data, harmonize data, and answer additional questions by combining these data sets as well. We co-support with NIAID the IMPACT Network, the International Maternal, Pediatric, and Adolescent AIDS Clinical Trials Network. And there's a protocol that's just been, or about to be, I think it's now been finalized, 2032, that's going to be looking at PK and safety of remdesivir in pregnant women and non-pregnant women. And then as I talked about already, really trying to advocate for inclusion of pregnant women and children in a lot of the other important activities that are going on, especially related to therapeutics and vaccines. Next slide. And then another network that Dr. Tita is very familiar with is our global network for women's and children's research. And they've really leveraged an existing, I think a decade-long existing global pregnancy registry to then now design a study utilizing antibody testing to assess maternal, fetal, and neonatal outcomes of SARS-CoV-2, as you can see in, I think, 9 different countries across the globe. And so that's really also a very exciting effort that, again, is building and leveraging an existing network and registry, and now adding on this important research project. Next slide. So as I mentioned, I wanted to touch a little bit on maternal mortality, which, as you all know, is rates are are disturbingly high in the United States, and especially among our Black and other minority communities. So really is a research agenda that's quite comprehensive that's being proposed. So next slide. So these are just some of the numbers that many of you are probably familiar with, that in this country, there's 700 to 900 maternal deaths per year, and these rates are substantially higher than other developed countries. But importantly, again, it's sort of the top of the pyramid or tip of the iceberg, you know, what those deaths are unfortunate outcomes of what are then many, many more near misses. We also have a lot of issues around pregnancy in women with co-occurring conditions. As I mentioned before, our rehab medicine center, one of its areas of one of its priority areas are pregnancies in individuals with disabilities. And so there is a large morbidity and mortality agenda here that sits on the fact that we have 6.3 million pregnancies per year in the United States. Next slide. So we, of course, this slide is just to remind us about the range of different conditions and timings of them, but then the importance, of course, of cardiovascular issues and bleeding complications. And so, as you can imagine, while NICHD is one of the leads for these kinds of efforts, we have a great partner in the Heart, Lung, and Blood Institute. And then what's not represented here, but what we all know is very important, are also mental health conditions. And so NIMH, the National Institute of Mental Health, is also involved along with other institutes, but it's really those three, and our Office of Research on Women's Health that are helping to lead the development of this agenda. Next slide. And so it's called IMPROVE, which is implementing a maternal health and pregnancy outcomes vision for everyone. As I mentioned, it is a trans NIH initiative. And again, it's quite comprehensive, as you can see with the wheel down at the bottom, but really going all the way from foundational biology to social and behavioral and health disparities research. And of course, like any important research like this, community partners will be key voices to assess needs and to implement interventions. And there've already been a series of listening sessions and workshops to engage the community and hear from the community. Next slide. So if you just click through maybe 2 or 3 times. So this effort, yeah, that's good. So this effort is actually already been, the deadline is already passed, but I wanted to just highlight it as an example of the kinds of activities that should be coming forward in the coming years. So this was a call for supplements initially to existing grants, and these supplements have come in and been reviewed, and decisions are being made now. But what I wanted to highlight here is, again, that you can see from what's written here are going to be the flavor of, I think, future funding opportunities as well. So the importance of incorporating community partnerships and participation. Again, the whole issue around the importance of health disparities and health equity. But then there is a biological agenda as well. And so, I think what you will see through this IMPROVE initiative is a number of number of opportunities that are going to be coming in the coming years. Next slide. And then several years ago, Congress asked NIH and specifically NICHD to lead a task force on research specific to pregnant women and lactating women, and it's called PregLac. Next slide. So this was established now several years ago, and in the first phase, it was tasked with developing a set of recommendations that then would go to the HHS Secretary and Congress. So that went from, I think, about the early 2017 to, as you can see in that first bullet, a report was submitted to the HHS Secretary and Congress in September of 2018. I've listed some key recommendations there. I don't think any of them are going to be surprises to this audience. I won't go through them here. But you can find the report and all of the recommendations there. But importantly, one of the recommendations was to extend the life of this panel to then plan on how to implement these recommendations. And so that's what's been going on over the last 8 to 10 months. Next slide. And those recommendations for implementation, as you can see in the last bullet, were just submitted earlier this month. And so again, the hope here is that that we've sort of, with broad input from both investigators, other agencies within NIH and HHS, is really to come up with a comprehensive agenda to address the development of therapeutics, both for pregnancy-related conditions, but importantly for treatment of co-occurring conditions during pregnancy and lactation. Like with many of these kinds of things, the hope is that our members of Congress will be compelled by this to actually provide funds to support this kind of research. But next slide. In the meantime, we try to look for opportunities within our existing resources to be able to start off on some of this work. And so this is just one example of using a pediatric study that's within our Pediatric Trials Network to be able to study drugs in lactating women. And so it's called the Cuddle study. Already we have about 800 participants, actually as of 6 or 7 months ago. And so an example of how, while we wait potentially for additional resources to do some of this work, looking for ways to utilize existing projects to be able to at least jumpstart some of the activities. Next slide. And then this is my potpourri of miscellaneous items. Next slide. So one is DASH, which is our data and specimen hub. And you can see the URL is down there at the bottom. So this is a centralized resource for researchers to both share, so to actually meet your data sharing requirements, but also importantly for requesting data for secondary analyses. And then now more recently, actually have some of the studies include biospecimens, and many of those studies actually involve pregnant women. So, I think, again, important resource. The data here there's a relatively benign process to obtain the data. The specimens, it's a little bit more difficult. And you do have to have funding for the specimens, but really is a tremendous resource. As you can see now, there are over 170 studies. There have already been almost 240 data requests. And really what we like about these, because we really try to capture this information to assess the impact of it, is already 39 publications. So I think, again, especially for trainees and junior faculty, where you're working on a primary research project and it's going to take you several years to work on, these are ways to, I think, generate hypotheses, to start exploring some of the things that you're doing with data that have already been collected and are collated as well. And so really encourage folks to look at the DASH website, but also recognize again that other institutes have similar resources as well. And I've listed there some of the study topics. Didn't go through and highlight what would be relevant to the group, but as you can imagine, with the NICHD's agenda, a number of the topics, important topics, are represented by studies here, I think, that would be relevant. Next slide. And then this is just an example of one of the workshops we have. And I think, again, this is another tip, I think, is that NIH sponsors a lot of workshops. In general, the reason after we do a workshop is we kind of collate that information, and that helps inform potentially subsequent funding opportunities. And so I think it's important to be aware of the kinds of things that are going on in these workshops, because oftentimes you'll then see, sometimes our bureaucracy takes us a while, so it sometimes is a while before we will launch or publish some kind of funding opportunity announcement. But I think it's important tip to know about that. But you don't have to wait for a specific funding opportunity announcement. You can recognize that if NIH puts together a workshop, then that's probably a priority area. Oftentimes these workshops will end up publishing some kind of research gaps or research plan. And so those are important documents, important information to look at as you're formulating an idea. Now, Candace, I don't know if this, I think we'll have the time. I don't know if that first link URL is a video, if it'll work or not. May not. Anyway, and I'll just, this is and if it doesn't, we'll go back, but just to say it's like a 2.5-minute video of our director just talking about the workshop and some of the major themes in it. And then the second link is a link that describes some of the highlights from the workshop, but also importantly actually includes the link so you can watch the archived workshop, see what's been published out of the workshop as well. So again, for this particular area, I think you know, so hopefully some valuable links for you. Yeah, it doesn't. Stacy, I think had warned me that it probably wouldn't work, so that's fine. So now you're probably frozen. So I think what I had next was the loan repayment program. So let me just, you know, Alan had suggested that I just highlight some key features of that. So I have a couple of slides there, but I think just important, I want to just make sure folks are aware of it. And then of course, like everything, there's lots and lots of information on the website around the loan repayment program. And then what was my final slide? I should have. So I will say then the other slide I know that I have in there is we have a lot of job openings at the NIH and specifically at the NICHD as well. Here we go. Okay, so first I just pulled some current. So these are currently on the street with deadlines that are coming up soon that I thought would be relevant to this, this group. So there's a brand new maternal and pediatric precision in therapeutics set of centers, P30 and a P50. There's an SBIR, which is a small business grant opportunity for non-invasive diagnostics to improve GYN health. There's an elucidating the role of nutrition in care and development of preterm infants, RFA. And then our Contraception Development Research Center program, which is an ongoing program, has a competition coming or currently now as well. And I also want to just highlight again for folks that are not so familiar with NIH, an RFA as opposed to a PA or a PAR. So it's a question that a lot of people ask. So an RFA, a request for application, in general, has a set aside amount of money for that activity. So it basically means that when you're applying for that, there's already been money set aside for that opportunity. And then often, or most of the time, it also means that there's a separate review panel reviewing just for that opportunity. So an RFA means NIH has already said, we are putting money behind this. We guarantee, well, not guarantee, you never guarantee, but we plan if we get a budget that we're going to put money behind it. Whereas a PA or a PAR, program announcement or a program announcement with review, does not have a set aside. So people will sometimes say, what announcement should I apply to? Well, you know, you don't need to wait for a PA or a PAR that specifically calls out, for example, menstruation or endometriosis. Because what that means is, yes, we're publishing that we think that's an important topic, but it's not, we're not able to say it's so important that we've already set aside money for that. So it means that when you apply, you're competing with everything else that goes on at the NIH, as opposed to an RFA. So I think it's, again, important piece to think about because, you know, frankly, the competition for RFAs, while still quite fierce, is relatively limited because it's a small number of you competing for a definite or almost definite bucket of dollars. And again, in the question and answer period, if there are more questions about that, I'm happy to answer that. But that's a common question that we get. What's the difference between the flavor of announcements? Next slide. So this is the loan repayment program, as I mentioned. And so here, you know, here's how it works. You commit to perform research for 2 years. NIH repays up to $50,000 a year of your qualified educational debt, and importantly, covers the resulting federal taxes, since this is considered income. And of course, what we're trying to do in providing this opportunity is really to encourage folks to engage in train and engage in a biomedical research career. So, and this is really our way, we're one way that we have of trying to expand and increase our pipeline of promising young investigators. Next slide. And so here, what I've listed here are the 6 available NIH loan repayment program subcategories, but what I put up there is 4 of 6 because we at NICHD at least only support, or not only, we support the top 4. But as you can see, one of them is contraception and infertility research, for example, health disparities research. So again, certainly something to look at if you're you know, in training and have substantial loans. And next slide gives you some sense of some of the requirements. You have to have a doctoral degree, U.S. citizen or permanent resident. Your research time has to be at least 20 hours a week. Your debt has to be at least 20% of your annual income. And there's some issues there around research funding. Next slide. And as I mentioned, like lots of things, there's lots of information about this. I put the website there, and then also there is each institute will have a contact that you can reach out to as well. But there's also, looks like, a central email address there as well. Next slide. And so then I mentioned we are hiring. You know, it's a different sort of career working at the NIH, but you know, we have a lot of opportunities, and I will just say a couple things. I mean, I certainly would be happy to talk to anyone who wants to talk about what it's like to work at the NIH, but specifically for us at NICHD, you can also find out more information on this website. We are looking for a senior policy advisor for clinical research who would work with me. Very importantly, a very important branch for us, our pregnancy and perinatology branch. We are looking for a branch chief. And in fact, Alan, I've been thinking I need to reach out to you to try to see if you have some ideas of people we can try to approach and encourage to apply for that. And then within 4 of our branches, we currently have open positions as well, and that includes our pregnancy and perinatology branch. And so I would certainly be happy to talk about any of these positions, but also if you are interested, you know, you can also click on the link, contact the branch chief for those particular branches to talk about these kinds of positions as well. And then next slide. I wanted to end, you know, as you know, we are named after Eunice Kennedy Shriver. We're the only institute that's actually named after an individual, and it really speaks and honors her lifelong devotion to both research and care and inclusion of children with intellectual and developmental disabilities. So this is actually from the National Portrait Gallery here in Washington, D.C., and it's actually the first time that gallery commissioned a portrait of someone who was not a president or first lady. And what it depicts here is Mrs. Shriver with a number of Special Olympians and their friends, and really trying to depict how she is guiding them out of the darkness and towards the sunlight. And so I just thought I'd like to just share that. If you know, Alan has heard me talk, when I talk to a more pediatric oriented audience, I actually talk a fair amount more about how her vision for children with intellectual and developmental disabilities has so inspired that aspect of what we do within the Institute. But I thought I would end with that, and now open for questions, and it looks like I've left about 12 minutes. So I hope that's enough, but I will say I'm happy to be contacted if folks have questions that we don't have time for, or want to contact me offline about something else. Always happy to be available.
So Rohan, thank you so much for a terrific overview of NICHD. Obviously, there is a lot of information that can be obtained on the website. So we have plenty of time for questions. So please feel free to you know, unmute and speak up, or pose the question in the chat box. Are there any questions?
And Alan, if I'll speaker's prerogative, I may turn and just ask you a question, which is, you know, you've now sat on council for a couple of years. What has surprised you the most? Like, what did you have, you know, surprised you the most about NIH that before you came on council you didn't know and you think would be valuable for this sort of audience?
Well, I think, you know, the process when you're up there is really, you know, clear. And one thing that struck me was the fact that the council, you know, we have people who really speak up and advocate for different areas or items that are of interest, and NICHD listens. I really think, you know, listens. And a great example is this whole question about networks. I'm going to bring that up and maybe ask you to provide an update to us about where networks stand. But I think, you know, I was really pleasantly surprised by just how deliberative the process was, and how I think all the comments that came in after questions were put to the public, all those comments were looked at and addressed. So yeah, that's one for me. And so back to you on networks.
Okay, I'll get to networks in a second, but let me just for this audience, just to describe what council is. So, there's a whole peer review process. And so that's what we typically call a study section. Then there's a secondary level of review that happens in these advisory councils. And so they're tied to the grant cycle. So they're 3 times a year. And it's really to advise the director on what the peer review process has generated. And so what we do at council is review, as staff, we review the peer review and then make recommendations that the council members then weigh in on, with ultimately the director making the final decisions. But importantly, as you can imagine, discussions of grant applications is in a closed session, so it's closed to the public. Most councils have an open session every cycle. And again, there's lots of information in those open sessions around what's going on. And so again, and all of that is available. It's live cast as well as archived for all of the institutes. So even my infectious disease colleagues, NIAID Council, I think, is actually Monday. And it's a way to hear about what's coming, what's being proposed, some scientific highlights, and it is the director. So you get to hear, as Alan is saying, what kind of advice the director is getting and how the director sometimes is responding to that advice as well. So again, I think a tip for, again, part of my goal here is to try to demystify the NIH, and would throw that out as a tip as well as council sessions. With respect to networks, I think many of us, and I'm looking around the table, the virtual table here, but Ed Acosta is not on it, though I asked him to be on. I don't know where Ed is. But, we know how much tremendous research has been generated from our large clinical trial networks. And so I've mentioned over the course of this talk, the MFMU, the Global Network, the Pelvic Floor Disorders Network. I mentioned our Impact Network in pediatric HIV. And so there is a very, very strong commitment to that there's certain science that does require clinical trial networks. I think the big issue for Dr. Bianchi is that she really wants to make sure how we manage those networks is kind of, for what we want to do in the 2020s, and not base it on a structure that came, say, from the 1980s or 1990s. And I think importantly there, number one is for these networks to be more of a resource to the general medical community. I mean, again, one of the things I say all the time is no one has a monopoly on good ideas. And so how do we make these networks? Yes, they will have a pre-specified research agenda that was written up in the grant application, but how do we make sure that that's a resource for new ideas that potentially may come from outside the original network investigator? So that's number one. Number two is then really making sure data and specimens are available to the community after the fact. What I've not talked about is structure, right? I mean, I think that was the thing. I think we probably at NIH or NICHD got a little too focused on what we name the structure, as opposed to thinking about what is it that we're trying to accomplish. And so I think we're going to be getting there, where we'll have a structure that will both retain what's been so good and so productive of the networks, but allow some of this more openness to new and emerging ideas. But certainly a very strong commitment to the networks.
Thank you.
Do
you have a question?
Alan,
hey.
Alan, sorry. Go ahead, please.
Question.
No, go ahead. Whoever. So
was that Dr. Richter?
Hello.
Yes. I'm not sure who is speaking, but there's a female voice. Please go ahead.
Okay, very good.
Right.
Thanks so much, Dr. Hazra. Your talk was so informative and so helpful. We have a lot of young investigators that are trying to jump off, so this was very insightful. I also want to thank you for the shout out for PFDN. You're right, we have been in the network here at UAB for 20 years. And just to that point, I was a little surprised at the strategic plan. And you know, in terms of its previous prioritization of pelvic floor disorders networks, which, as you know, pelvic floor disorders actually do result from vaginal deliveries. So kind of a sequelae of what women go through during their reproductive time. I was just wondering, in your opinion, where do you think is the best fit? You talked about a best fit for various agendas. Where do you think the best fit for pelvic floor disorders is?
So, you know, I mean, again, I'm biased. We have, as you know, our gynecologic health and disease branch. It's overseeing that network. It's productive. I think that's where it fits. You know, again, I know I can't talk about what's going to be coming that's not yet public, but that's where it's going to fit. And I think one of the things that we're seeing, and again, this is maybe a bit too much inside baseball, but you know, is how branches, how at least we at NICHD, how we do funding decisions is really based upon what comes in. But as you probably know, you know, that branch is a relatively new branch. It was started only in 2012. And we, I think at NICHD, have to figure out a little better way when we start new programs like that, how to make sure that the funding is there for them. Because our branches right now do not have their own budgets. The budget is based upon what applications come in that have good scores. And I think there are probably certain areas, and I think the strategic plan and those aspirational goals will help at some level of how we direct some of our discretionary funds to try to stimulate some of those areas.
Thank you so much. And again, I just thank you for your willingness to talk with us, and let's keep the conversation going.
Great. And nice to meet you. I talked to Lisa Halverson this morning, so.
Great. Great.
Yeah, great. Nitin had a question, I think.
Yeah.
Dr. Hazra, thank you so much for this great talk. Especially as a junior investigator, it's very useful to kind of understand the entire organizational structure and the funding mechanisms that are available. So maybe you alluded to, I mean, the answer of the question I'm about to ask in what you were saying earlier. So there was an RFA that was directed towards COVID-19 that ended in like June of this year through the NICHD. And maybe you can answer this question or not. Just, are there any more funding opportunities coming towards the end of the year to look at the impact of SARS-CoV-2 on pregnancy outcomes more from a mechanistic standpoint?
So a couple of things, Nitin. I think, you know, first of all, as I mentioned, right, between RFA and PA or PAR is important to look at. As part of this council review, in the open session, and this is available on the website, the staff present upcoming ideas. So that is a publicly available way to know what is coming. And so that's another resource. But again, I will emphasize, you don't need to necessarily wait for a specific announcement to be able to apply as well.
So I say one, is that Nitin, are you good?
Yes, I'm good. Thank you.
All right, terrific. So I see one in the chat box, which is from Dr. Porred, which says, yeah, thank you for a great talk. How can extramural investigators influence the research priorities, workshops, RFAs that are being developed at NICHD?
Great question. So I think, you know, Alan, you kind of touched on this. You've seen that, you know, we put out requests for information and then really review the comments that come in. I think one advantage of now so many meetings having to be virtual is you don't need to have a travel budget to be able to attend, you know. And so in these workshops that NIH is organizing or co-organizing, you know, I think certainly within the chat box or within the question and answer session to be able to speak up as well. And then finally, as I said before, there are humans behind all of this that we're talking about. And so if there's a particular area that you're interested in, go find it on the website, figure out who the program official or the branch chief or whether it is, and really do reach out. Some people may not be so responsive, but in general, we try to be quite responsive and engage in discussions also. So I would say, you know, look for opportunities when NIH is officially asking for input, but also unofficially, certainly, again, reach out to NIH staff to get information and to provide input.
I couldn't agree more with that, Rohan. Even as a junior investigator, just having that apprehension about reaching out, but reaching out is just so useful. There is one last comment. We'll take one last question, which is, what is the general rate or percentage of funding by NICHD? This person has been discouraged to submit to NICHD because of supposedly low funding rates.
Yeah, so these change, and these are all publicly available. I don't have the numbers off the top of my head, but they're pretty low. I mean, again, it's nice that I'm being so positive about stuff. I recognize it's tough, but I just want you to know that certainly we want people to succeed, right? We as program staff want people to succeed, and so we'll certainly try to work with you, helping you decide, should you resubmit versus should you go in another direction? Maybe this is not the right branch or not the right institute. How can we help guide you that way? We're certainly there to try to provide that advice. But you are right. NICHD, when you look across all the institutes, in fact, Alan, I think Dr. Valentine showed that yesterday in one of the slides. NICHD, I think, was about the third, at least for that one, I think it was R01 equivalence. For certain areas of research, but we were, I think, the third worst, and National Eye Institute actually was at what, 27%, and I think we were about 9 or 10%, but that was for one particular area. But that tends to be what it is that our funding rates are on the low end. We're constantly looking at ways, but as you can imagine, our funding rate is it's simple math, right? It's number of applications that come in, and then how much money you're appropriated from Congress, right? So one of the things we could do we can improve our funding rate by decreasing the number of applications. Well, we don't want to discourage people to apply. And so then the other is, how do we increase our budget? And of course, that's not in our, that's again for others to advocate elsewhere, not to us, for the importance of our populations and why we want resources for maternal and child health.
Terrific, Rohan, thank you. And I've been very impressed by the intentional way, by which the Institute and NIH as a whole are really working towards bringing along young investigators and having different pay lines or, rates for them as well. So that should not, necessarily discourage, it shouldn't discourage those who are driven to do this.
Right, absolutely.
Yeah, so thank you so much, and really appreciate you taking this time, a virtual trip to Birmingham, and wish you the rest of a great weekend. Thank you.
Thank you very much for the invitation.